Today we're going to be talking about the differences between respiratory acidosis and respiratory alkalosis. They're both meaning in terms of ABGs or arterial blood gases. It's a lab test that's drawn by patients that we have to take as a diagnostic procedure to tell what's going on internally with their organs. So respiratory alkalosis means, or anything that has to do with respiratory has to mean that the lungs and how the carbon dioxide exchange is happening. So respiratory alkalosis, it means that their body is more alkalotic. It means that they have not enough CO2 in their body. So a lot of patients that have respiratory alkalosis will complain of hyperventilation. It's like number one. They have an excess loss of CO2 in the body. So it causes a lot of confusion, lethargy. Patients might complain of hypokalemia. They might have a decreased or a normal blood pressure. Those are all common symptoms. They'll be just not being able to catch their breath, really. So if you have respiratory alkalosis or respiratory acidosis, it means that the body has too much acid in it, basically. Respiratory acidosis usually has to do with airway obstructions, usually like bronchitis or bronchospasms. A lot of emphysema patients struggle with respiratory acidosis. Lung diseases like fibrosis and pneumonia, a lot of things that have to do with clearly the lungs. Acidosis means that they have a retention of CO2 in the lungs, so they're not able to expel it as properly. So if the body is retaining a lot of CO2, patients are going to be paler, they're going to have cyanosis, they might suffer from hyperkalemia, they're going to have dysrhythmias, headaches, rapid and shallow breaths because they're not able to expel their CO2 as properly. So a lot of patients, if you have COPD, which is a lot of the patients that suffer with respiratory acidosis, their number one classic hallmark sign is going to be a caved over chest, a diaphragm. It's not opened. They're trying to open it up and they're trying to expel the CO2 out because they're probably going to have a lower pulse ox if you take it. So some ways to clear up respiratory acidosis and alkalosis, you might be able to give somebody a bag. I know it sounds very cheesy, but patients with respiratory alkalosis, if you've ever seen somebody on like an airplane and they're breathing in, they're trying to bring in the CO2 into their body so their body is able to give the oxygen out to the cells so they're dying. A lot of lightheadedness occurs for people with respiratory alkalosis because they're not exchanging the gases properly. So hyperventilation, obviously, they might have anxiety, fear, might be inducing a lot of the alkalosis. Respiratory acidosis, you might want to give somebody a nasal cannula or a rebreather mask. It might help with the deep, shallow breaths because they're not obtaining enough oxygen. So once we're not obtaining enough oxygen, then the patient's cells are going to start dying off. They're going to have a hypoxia. Hypoxia is not good. It's going to lead to the cyanosis. It's going to lead to the depletion of the different organs. It can cause organ failure if they're not receiving enough oxygen to them. Their bodies can't, just like we can function, our organs can't function. So it's just a full circle. So I have this chart right here. This is really nice. We learned from this as well in school, the signs and symptoms and the different telltales for a patient that has respiratory alkalosis versus acidosis. So seizures are common with alkalosis, as well as mechanical ventilating these patients. It's a number one thing that usually they're going to be able to do if they're not able to catch their breath. There's not really a medication that you can give them rather than just maybe giving them something to calm the anxiety. If you can cause the underlying cause, if you can fix the underlying cause for these patients, or if you have a patient that has respiratory depression for acidosis, so they're going to give them a bronchodilator, you're going to give them maybe albuterol, something that's going to open up those airways and lessen the constriction. If we're dilating things, then it's going to open it up and they're going to allow the O2 and CO2 to properly exchange with one another. Disorientation and dizziness and drowsiness is also something that has to do with CO2 retention. So if you're a patient suffering from respiratory acidosis, that's another thing rather than the hunched over chest. It's very typical. And I believe that's it. So if you have a patient that comes in with all of these signs, the number one thing that you want to probably do is somehow if you have a patient with respiratory alkalosis, you probably want to have mechanical ventilation, or you maybe want to have some type of medication on standby to treat the underlying cause. It's typically like fear and anxiety induced hyperventilation. Or if you have a patient that has respiratory acidosis, you want to definitely get them on a nasal cannula. You want to definitely try to figure out what their underlying cause is when it comes to the constriction. Or if you have any bronchodilators, or like I said, any type of airway opening medications, short or long acting, are typically used in an emergency situation. So those are the number one things you want to do: ABC, airway, breathing, circulation, for these patients, maintain their airway patency. Does anyone have any questions? No? All right, thank you.